So our lecture today is osteomyelitis. Osteomyelitis, it is one of the inflammatory bone diseases. As we can see here that osteomyelitis, osteo that means bone, myelitis, the medullary spaces or the tissue of the marrow spaces. TIS, it means inflammatory process. So osteomyelitis, it is inflammatory process involving periosteum, cortex, and medullary spaces or marrow spaces. That means that osteomyelitis involves all the component of bone. Osteomyelitis can be classified into acute osteomyelitis or suppurative osteomyelitis. And there is suppurative osteomyelitis. Suppurative, that means there is pus formation. So there is acute suppurative osteomyelitis and there is chronic suppurative osteomyelitis. Also, there is another type of osteomyelitis. That means it is not suppurative. That means there is no pus formation, which is usually chronic type. And this is usually occur due to sclerosing bone. That means the bone becomes sclerosed. So in this case, it's called chronic sclerosing osteomyelitis. And there are types of chronic sclerosing osteomyelitis. Could be focal or localized, so it is called focal sclerosing osteomyelitis, or could be diffused, involve large area, also could be called chronic diffuse sclerosing osteomyelitis. Or also there is another type, it is called Gary's osteomyelitis. All of these types will be discussed later on in the lecture. There are many predisposing factors for the development or for establishment of osteomyelitis. But in general, there are two factors should be available in order to establishment of osteomyelitis. The decrease in the blood supply, or what we call vascular component, and traumatic component, or traumatic factor and vascular factor. The vascular factor means decrease in the blood supply, and there is a trauma. This will lead to establishment of osteomyelitis. So in general, these factors or predisposing factors includes poor nutrition, chronic debilitating disease such as diabetes mellitus patient or diabetic patient more predisposed to development of the osteomyelitis. Dental disease, the dental disease could be periapical, periodontal, or could be pericoronal. Actually, sometimes osteomyelitis could be developed after tooth extraction if there is infection. Alcoholics with malnutrition, impaired immunity. As we can see, most of these factors related to immunity of the patient. Therapeutic irradiation. In case of therapeutic irradiation or case of irradiation, there is decrease in the blood supply. And since there is decrease in the blood supply, any trauma will lead to establishment of osteomyelitis. Patchy disease, actually in case of patchy disease, there is more bone formation. So since there is more bone formation, there is a reduction or there is a reduction in the blood supply, and this also will lead to establishment of osteomyelitis. Now, acute suppurative osteomyelitis. Suppurative, that means there is pus formation. As we can see here, there is pus. It is one of the sequelae of periapical infection. If the periapical infection not treated, the infection may spread to marrow spaces, and this will lead to establishment of osteomyelitis. The causative microorganisms could be anaerobic bacteria or could be Staphylococcus aureus. The causes could be dental infection, periapical, periodontal, or even pericoronal. But as I mentioned before, most commonly it could be a sequelae of periapical infection. Sometimes the microorganisms or the infection may spread to jaw bones through the blood supply, what we call hematogenous spread. For example, the infection of the middle ear may spread through the hematogenous route. The other causes for establishment of acute suppurative osteomyelitis could be due to jaw fracture. The microorganisms penetrates the jawbone and lead to establishment of the osteomyelitis. Could be through the gunshot. The clinical feature of acute osteomyelitis, deep-seated severe pain. Deep-seated because the inflammatory process involves the medullary spaces or marrow spaces. So there is deep-seated severe pain because there is oxidate, there is a pressure on the nerve. So there is severe pain, and deep-seated because it involves the medullary spaces or the tissue of the medullary spaces. Premolar, molar region, that means body of the mandible, also could be involved. Indurated swelling of moderate size, since there is infection within the bone, within the medullary spaces, there is actually edema, and there is also oxidate and edema, a reaction to oxidate, and this is usually indurated because it is deeply seated. Paresthesia of the lower lip, which is the most pathognomonic feature of osteomyelitis. Why? Since there is oxidate within the medullary spaces, so the oxidate press or cause pressure on the nerve, inferior irregular nerve, and this will lead to paresthesia or anesthesia of the lower lip. The teeth in the region, in the affected region, usually tender because there is infection, loose or mobile. There is bone destruction. Oxidate discharging via sinuses in the alveolar process. Actually, this is in case of chronic. That means when the acute, because chronic, there are two types, could be primary or secondary. Primary, that means developed by itself. Secondary from acute osteomyelitis. So sometimes the sinus may be or the oxidate discharge through the sinuses in the alveolar process. Regional lymphadenopathy, enlargement of the lymph node, and pyrexia, which is elevation in the body temperature. The radiographical feature of acute osteomyelitis. Actually, it is not obvious. That means there is no evidence until after 1 to 2 weeks, after 10 to 14 days. There is ill-defined margin, as we can see here, because there is bone destruction. Moth-eaten appearance here, as we can see. Why there is moth-eaten appearance? Because there is non-living bone surrounded by new bone formation, by living bone. So there is no living surrounded by new bone formation. The pathogenesis or pathology of acute suppurative osteomyelitis, there is pelvical infection, for example, spread to medullary spaces, so there is acute inflammation within the marrow tissue, spread of oxidate along the marrow spaces. Since there is oxidate within the marrow spaces, there is blood supply, and this will cause thrombosis of the blood vessel because there is compression. Oxidate causes compression on the blood vessel, so there is thrombosis, there is decrease in the blood supply, and this will lead to bone necrosis. Bone necrosis may undergo liquefaction, and this will lead to lifting of periosteum. That means the periosteum elevated from the bone. So since bone takes more of the blood supply from periosteum, since the periosteum away from bone, so there is a reduction in the blood supply to bone, and this will lead to further necrosis, and eventually or finally there is activation of the osteoblast cells, and this will lead to the formation of sequacitrum, which is non-living bone. The management could be surgical by incision and drainage in case of this separation. Debridement, that means cleaning of the area, and also could be given medications, antibiotics and analgesics. Sequacitrum, which is non-living bone, it should be removed because if it is left, it may consider as foreign body, and this will lead to further infection and inflammation. So if the sequacitrum is small, it can be exfoliated by itself through the mucosa, but if it is large, it needs surgical removal, incision and removal of the sequacitrum. Involucrum, actually this is the sequacitrum is non-living bone. When surrounded by living bone, this is called involucrum, and there is actually there is some soft tissue or there is some connective tissue separated by being separated actually between the sequacitrum and the involucrum. These connective tissue separates between the involucrum, the new bone formation, and sequacitrum. This is actually interposing between the involucrum and the sequacitrum. Actually, this is the reason why the sequacitrum is mobile, because it is not attached to the bone, but there is connective tissue separates between the involucrum and sequacitrum. If there is untreated cases, it will lead to periostitis, and also sometimes spread of the infection to soft tissue causes abscess or cellulitis. So this is the end of the lecture, and in the next lecture we are going to discuss chronic suppurative osteomyelitis.